Summit County officials say we're just weeks away now from running out of ICU beds. Caroline Sweeney explains why there's growing concern now that there may not be enough caregivers to treat those patients.
And in some way you think this really can't be happening to us, but the reality is it is.
The number of available ICU beds in Summit County is shrinking.
The last information that we looked at in regards to being full, it was about 90% at capacity.
Right now, the county is on a watch list from the state. It's poised to move from red to purple on the state's risk map if numbers don't go down. And it all hinges on what happened over Thanksgiving.
We could be about 2 weeks away from filling our hospital and also needing additional staff.
County Health Director Donna Skota says slowing the spread of this virus means a behavior change for residents.
I think there are some individuals that don't really see it as disease control, but rather an issue of taking away one's rights. But unfortunately, it is a disease control issue.
If the spread doesn't slow, the county is close to a tipping point for available ICU beds.
We have between 55 and 60 critical care beds here at Cleveland Clinic Akron General. Pretty much every day for the past 2 to 3 weeks, we've been at or near capacity.
And if the beds fill up, patients will be diverted to other hospitals which are also seeing high patient rates.
Now, we try to do that as a last resort for the sake of the patients and families, but it is an option. The problem is it's not much of an option when all the hospitals are currently facing the same situation.
Hospitals are not only seeing a bed shortage, they're also seeing a staffing shortage. Healthcare workers are getting sick while trying to keep people healthy.
This has been physically and emotionally beyond exhausting, particularly for our critical care nurses.
Hospitals across the country are seeing reserves of highly trained staff dwindle. And if that happens,
eventually you won't serve all your rooms, you won't close units if you don't have staff to cover safely.
Donna Skota and Dr. Brian Hart implore people to heed CDC guidelines to wear masks, stay 6 feet apart, and wash hands. In Cleveland, Caroline Sweeney, News 5.